is the ability to needle into the shoulder or into the hip in a slightly deeper way than we may be used to. And so I really want to use the majority of today to get over or understand some possibilities in mechanics. So just like with the huatuos, you realize that there's bone there. You can't get to anything scary, even if you're out, because there's bone. And the bone is often wider or further than you thought. It doesn't mean you're reckless, but know the anatomy, know the bones, put a skeleton down. Same thing here. We want to be able to learn to place a shoulder and then needle in a way that we're able to get toward the capsule and be effective to get in there, because if we're going to get warmth and deep heat inside for bursitis, for a torn labrum, for anything else like that, we do need to be there. Because if we're not there, odds are that part of the treatment wasn't doing much. Now, a little thing to know about a torn labrum, and I think I've said this before in this course, but I'll say it again here, is that it's easy to diagnose whether it's a muscle tendon injury or a torn labrum, is that if we do a good job and they're not dramatically better in 2 to 3 treatments, it's a torn labrum. And if they got better, it wasn't. That's how you diagnosed it in the old days, right? Once you find out that the labrum is torn, or they come in and tell you, then our treatment strategy is a bit different in terms of what I need to do is first make sure those ashers are relieved so there's blood flow. Because what's going to speed or non-speed the healing of a torn labrum is warmth and blood flow. So if I tell you how to treat a torn labrum, but you don't first get rid of the vector so the area can relax as much as possible, it's not going to be effective. But once we know there's a tear and most of the ashers are out of the way, that's when liniments and patches and longer term heat to drive blood flow to the area so it heals quickly makes a huge difference. And that's where body work, some good tuina, getting in, working the area painfully, but then doing that press, and then that cooling sky release filling. And then warmth, warmth, warmth. And then we want to test them all the time, like, oh, that does not hurt as much. And then they say, it didn't hurt as much for 3 days, then it started hurting again. And then after 2 treatments, they say, it didn't hurt at all until I picked something up. And then it hurt. And then we know we're making progress on getting that labrum to heal, whether it's here or in here, okay? Shoulders are easier to heal in the torn labrum because they don't have to use it. But if they have an injury in here and they're walking a lot, or they have a dog or something, it's kind of like going uphill the wrong way just because of how much they have to use the hip. But that's where working from the outside in and body work really shine for a torn labrum. But work, and then they leave and no medicines on it in between is not going to be as effective. So you need to really keep medicine and warmth and flow in the area so it heals. Same with meniscus. I talked about that in the videos, how to treat meniscus, what that means, vectors, jamming, spacing, warmth. The reason why in Western medicine meniscuses they consider they can't really get healed is because they aren't paying attention to how do I increase the blood flow and space in the area. So many things, if we can increase blood flow and space, done. Doesn't mean it's magic, but that's when the healing is going to happen. Why did we get here? Oh, yes, to get in the joint. So getting in the joint without first making sure the area is relaxed is also counterproductive. Just like doing huatuo for a back injury when there's lots of ashers is counterproductive. So we have to remember our strategies. And I laid that out really clearly, is stop pain, consider temperature, good space, right? I mean, it was kind of like a 1, 2, 3, 4 of how to treat something in those videos. And if we follow that, we're going to be really successful as long as we're not reckless, but we're not so fearful that we don't actually get to where we have to get to, okay? And so we want to talk about those spacings, how to get in, and I want to demonstrate It's important to know that a lot of this needling was done sitting, but that, as I've said in the past, sitting, it's very easy for a patient to have a vasovagal response, particularly if their pulse is deep. So if we take a patient's pulse and it's a deep pulse, and then we hit a tender spot and they're vertical, gravity's going to kick in and the blood's going to drain out of there. And the next thing you know, you're giving your patient a juice box. Okay? So the decision on whether or not to needle sitting is not to be taken lightly. Let me borrow that chair really quickly. Official position for the shoulder, if you were trying to get in deep, it's almost impossible to get in deep this way. You can from here, but you really have to angle in, and I'll demonstrate that. But official is, this is a little high, a little low. But if everyone puts their hand on their shoulder, and then you slowly raise, there's a point where your hand drops, and then your hand comes back up again. Okay? Yeah? So here it is. And as I lower my shoulder, but I lift my arm, there's a spot where it divots. And that divot is Jin-Huai, eye of the shoulder. That's how you're going to find that. And then if I keep coming, it gets tense again. The muscle tightens again. So here, it's bone. How am I going to get in? And then there's oh, duh, gone. Okay? So we're looking for the sweet spot. Put the person's arm too high, you closed it. Person's arm is too short, you've closed, it's not open. This is not open, this is closed. This is, for me, just about right. All right? So, however, in this position, you're going to have some of your patients get really woozy on you, which is why in old China, if you look at the books, this was the needling position. Nice access, heads down. Exactly. Perfect. They start sleeping and you're doing your job. Okay? So putting the patient in the best position possible is very important. We should have had both cameras rolling for this just so I could demo quickly. And I'll demo it in a second when I needle. But James, if you just hop on here really quickly, face down. The second position for the hip is very simple, is what I'm going to do is we want to picture this part of his leg just like the shoulder. This is closed, and then I can kind of sort of open, but gravity kicks down and this pinches, right? So it's very hard to get in on this area in here. And so the needling technique is the body position technique is very simple. We lift the hip and we place our knee so that he's resting on the knee, okay? And then, wide open. I can really get in all of these positions. He's not tense. The body weight is on me. I have enough of a bend, but it's raised in the air that I can really get in to a hip socket, the head of the femur. I can really palpate around. And so if we could see inside his body, this would be his bone. There's the head. And I'm able to really get along without it being tight, tense, closed, or not open. So being able to bring a person on your knee, lifting them up, and then needling there's lots of positions. And I say one, you think of three. There's so many ways to apply a position like this, okay? So start thinking, what am I going to do to put that skeleton in an opener position for where I need to get to? And that's going to allow us to get where other people aren't so that we get the result that seems magical compared to other people when it's not magic. I just thought more about how to get to where I need to get to. Okay? So shoulder has a sweet spot. This has a sweet spot. This has a sweet spot. And if I take that out and it's down again, now all of a sudden that's closed in there. It's really hard to thread in. How am I going to get on it? Very difficult, very nervy. I'm going to hit Huantiao, gallbladder 30. He's going to get electricity all the time. I don't want the electricity for this. And I'm going to be almost 100% with electricity. I'm thinking, why was that not reliable when I wanted it? Now that I don't, zap, zap, zap. Taiyang channel zapping them, Shaoyang channel zapping them. But by moving things around, we're able to slip into areas. So important to start changing our thinking into how do I see what's happening?